Hello, I'm Caroline.
And hello, I'm Joe.
And Joe is an osteopath as well as a CranioSacral therapist, and we're both instructors for the Upledger Institute. But what I'm curious to ask you about, Joe, is tell us about the average day as an osteopath and a CranioSacral therapist in clinic.
The average day, I normally start between 9:30 and 9:45 with my first patient.
Yep.
And before I leave home, I sometimes check my list to see what I might expect for the morning and the afternoon. And from there, it could be a whole mixture of anything from a newborn baby to somebody who's in senior years.
Yep.
Some of my patients just have CST treatment. A few are just osteopathic, and quite a lot of them have a mixture of both. And within that mix, in any working week, some patients choose to go and have SER processes. Some patients don't. Some of them do it silently on the table.
Some of them choose to have SER process?
Yes.
Okay.
Yeah, they do. It's very much about their choice, not mine, whether they do that or not.
Yep.
So it's very mixed, which is great. So my days pass quickly.
Yeah.
And being self-employed, I have the choice to choose my hours as well.
That's nice, isn't it?
Yeah, it is nice. There's certain ones I have to do because I have a responsibility to my patients, and of course I have a clinic to run. And I'm very fortunate to have colleagues in the clinic.
Yeah.
I share my premises with another practitioner
Yeah.
that works in a different field than me, and I have associates who work with me doing CST and osteopathy as well. So we all bounce ideas off each other when we have to. It's really nice that we can talk and share ideas. If we get stuck, we can cross-refer. Yes, it's an interesting and varied week, and if I want some time off, I can, as long as I get into the diary quick enough to block it out, I can choose that.
Yeah.
So it very much is you make your own professional life with this work.
Yeah.
It's brilliant.
Yeah.
Yeah. How about you?
Okay.
Caroline, what's your day like?
So my days are a little bit different probably from that, Joe, because I run the Upledger Institute and the College of Body Science, and not to mention the teenage children and all of that. It's slightly differently. I treat at least one day a week, which is quite good. I've recently found Calendly, which is an online booking system, which has revolutionised the whole thing for me. Anyway, and then a lot of time I have the lovely Marilyn, that if you ever come and connect with us, you will probably speak to her first. And so she's in at least one day a week, but we speak a lot in the rest of the week. So there's always that kind of stuff going on. And then a lot of time is spent really, connecting with people, writing emails, doing some of the marketing, responding to students, preparing new classes, all that kind of stuff. So it's really varied.
Sounds very varied.
It is very varied.
But you're still there seeing patients, aren't you?
Still there seeing patients. Can't
Brilliant.
teach the work if you're not.
Absolutely
I don't
right.
think. And I do love teaching the work because it is quite extraordinary. And then I also manage to obviously fit in treatments on myself as often as possible.
Yeah, that's really important for us to have our own treatment too.
It is. And in fact, we're going to do that in a minute, aren't we?
Yes, it's an integral part of our development, isn't it?
Yeah, love it. Love it, love it. Cool.
Cool.